Hey everyone, today we're going to talk about the most common reproductive diseases in cattle. Included here would be brucellosis or Banks disease, leptospirosis, infectious bovine rhinotracheitis, bovine virus diarrhea, bovine virus diarrhea complexes, vibriosis, and trichomoniasis. Let's start first with brucellosis or Banks disease. It causes abortion and infertility. And it's important to understand that not all brucellosis infected cows abort. Some produce weak calves, retain placenta, or have trouble breeding back. Reactor cows may be normal in every observable aspect, but each time she calves, she produces a genital discharge. Okay. Also, there may be millions of brucellar organisms which are present on the surface of the placenta, the newborn calf, or discharges, which threatens to infect other cows. Okay. Although infection usually occurs via the digestive tract, a susceptible animal may also pick up the bacteria through the skin or eye. Contaminated feed, bedding, water, or premises may remain infected for a few days, up to a few weeks, depending on environmental conditions. Okay. How do we prevent the entry of this disease? We can maintain a closed herd by raising all our replacement heifers inside the farm. We won't be buying from the outside. Also, what we can do is to isolate breeding stock for 30 to 60 days upon arrival at the farm, and then we do a retest at the end of the isolation period. As far as vaccination, we can vaccinate all heifers between 4 and 12 months old. The calves should be properly identified. We can either use an official ear tag or an ear tattoo. We must also make sure that the bulls are free of brucellosis and all other reproductive diseases. Okay. Although brucellosis is rarely spread via breeding, it is still dangerous for a bull to breed an infected cow, and then afterwards, that bull will be used to breed a clean cow. Because bulls occasionally become infected, this is usually exhibited by a swollen testicle or a scrotum. Producers using artificial insemination should avoid semen from infected bulls, okay? Because semen can also be a vehicle to infect cows. Okay? We now move on to leptospirosis. This disease causes repeat breeders, low-grade uterine infections, abortions, mastitis, and occasionally systemic infections. Of the five or more strains of the organism, the three most common causing problems in cattle are Leptospira pomona, Leptospira harjo, and Leptospira gryphotyphosa. Okay. Leptospirosis can build up unrecognized in a herd. Okay. Prevention of leptospirosis, we need to vaccinate cattle with bacterians containing three or five serotypes every 6 months. Okay. We also drain stagnant bodies of water. We also eliminate rodents, especially rats, from any barns or sheds where cattle congregate. Okay. Next disease, we have vibriosis. It's a venereal disease causing infertility and occasionally abortion. This caused by Campylobacter fetus, which lives in the crevices of a bull's prepuce or foreskin. It doesn't usually become established in the bull until the bull is about 4 years old or older. Okay. The spread of this disease is through the breeding act from an infected bull to a cow or from an infected cow to a bull. Okay. Although semen from reputable bull studs is usually clean because of proper health examinations of the bulls and treatment of the semen, we should still request for a certificate of no diseases for our bulls. Okay. The disease can be transmitted through AI if precautions such as the ones I mentioned are not taken. Okay. Also, untreated infected bulls can remain carriers for a long time. Okay. Bulls can be clean yet transmit the disease from an infected cow to a clean cow. Okay. In females, vibriosis causes endometritis, resulting in failure to conceive or death of the embryo. Okay. The affected cows may conceive and not return to heat 21 days later. However, when they do conceive, the newly formed embryo may then die and then become absorbed by the cow. After that, she may then exhibit estrus from 27 to 53 days after breeding. Okay. Abortions occur late in gestation, but are unusual. Diagnosis is difficult and depends on identifying cultures of the organism from the genitalia of the infected cow or bull, or from the abomasum of an aborted fetus. We can prevent vibriosis by vaccination, also by using artificial insemination, and by treating animals which have been infected. We now move on to the next disease, which is trichomoniasis. It is a venereal disease caused by a protozoan organism, Trichomonas fetus. Symptoms include occasional abortions and pyometra that impairs breeding efficiency. Pyometra develops after the infected cow's embryo dies. To treat the female, treat any uterine infection and provide sexual rest, usually a 90-day period. Vaccination is also an option in cows. Also, before use, test the bulls using culture methods at least 3 times at weekly intervals. Okay. We should also encourage the use of clean semen from reputable bull studs, which also helps to prevent infection. Okay. You see, frozen semen containing the organism can be a source of infection. Okay, so here's a table of everything we've discussed. For brucellosis, it causes a bacteria and it's spread through aborted fetuses as well as fetal membranes. And then the state of gestation at abortion would be around 6 to 9 months. And the samples we collect for diagnosis would include blood sample from an aborted cow. We should also collect fetus as well as placenta. And for vaccination, we use live vaccine in heifers at 4 to 12 months. Recommendation would be to cull infected animals and not to vaccinate bulls. Okay. With leptospirosis, it's also bacterial and it's spread by the urine of infected animals and aborted fetuses. The abortion occurs at any stage, but usually 6 to 9 months. Okay. To diagnose it, we need to sample about 10% of the herd, and then vaccination is every 6 months, 2 to 4 weeks before breeding. Okay. The laboratory should be able to determine the serotype of the leptospira causing the infection. Okay. For the next disease, which is red nose, it's a viral disease. It's contagious and is passed from cow to cow. The abortion occurs 6 to 9 months, and for diagnosis, we should be collecting fetus, placenta, as well as blood samples. Okay. For vaccination, it's either killed or modified live vaccine, and the abortion may or may not be associated with illnesses in cows. Okay. For virus diarrhea, BVD, it's caused by a virus. It is contagious as well. It passes from cow to cow. And the abortion is variable, but usually it occurs during early in the gestation. And then the samples needed for diagnosis would be 2 blood samples, which are 3 weeks apart. Okay. Vaccination is either by a killed or a modified live vaccine. And then the calves are born with the disease. Sometimes they have loss of hair as well as brain damage. Okay. For vibriosis, it's caused by a bacterial agent, Campylobacter fetus venerealis, and then it's spread by infected bulls, and abortion happens early and oftentimes there's repeat breeding in there. And then what we collect is vaginal mucus from infected cows, cervical mucus, fetuses, and also preputial washings from the bull. Okay, what we do is provide 2 injections of the vaccine. In the first year, that would be 30 to 60 days before breeding. Bulls and cows should be vaccinated. And we now move on to vibriosis. It's caused by Campylobacter fetus intestinalis. And then it's spread via ingestion. And abortion occurs in animals that are greater than 6 months into the gestation period. And then the samples needed for diagnosis would be fetus. There's no vaccine yet for this one, and the disease causes sporadic abortions. Okay. Next disease we have trichomoniasis. It's of protozoal origin, and it's a venereal disease spread via the sexual act. And abortion occurs in gestation that's within 2 to 4 months. And what we collect are preputial washings from infected bulls, also the uterus from cows that have been culled. Okay. For vaccination, the first dose would be 60 days pre-breeding. The second dose at 30 days pre-breeding. And we then provide a single booster annually. Okay. The treatment consists of sexual rest for our cows for 90 days. Also, we would utilize artificial insemination, and then we call infected bulls as well as open cows.